All right, it's March, and that means it's Colorectal Cancer Awareness Month, and we're talking about screenings. Emily Kaczynski, a certified genetic counselor, joining us now with the MedStar Health Cancer Network. Thanks so much, Emily, for coming back in.
Thanks for having me, Kelly.
Okay, so we're talking about 23andMe and this new FDA-approved report. Tell us what it is.
So they were recently approved to test for the MUT-YH gene, which is just one gene that's associated with inherited colon cancer. We actually can test for over a dozen genes linked to different colon cancer syndromes. So in my opinion, as a genetic counselor, it's a very limited test because it's only going to look at that one gene. So for people that are concerned about their risk for colon cancer or have a family history, I recommend sitting down with a genetic counselor because they can really look at the family history and determine if they need genetic testing and then talk about the different testing options rather than just looking at that one gene.
But you said that there are some genetic tests that maybe can test for multiple cancers, correct?
Yes, yes. So a lot of the genes linked to colon cancer are also linked to other types of cancer like uterine or ovarian, other GI cancers like pancreatic or stomach cancer. So it's important to not just look at your family history for colon cancer, but those other cancers as well.
So who would you recommend come to see you? What is a good candidate for somebody to come to see you?
So anyone that has a personal history of colon cancer diagnosed young, so 50 or younger, if you've had colon cancer more than once, so 2 primary colon cancers, if you have multiple family members with colon cancer or other GI cancers like stomach cancer or pancreatic. Also, if you have a history of 10 or more precancerous polyps, or what we call adenomas, that's suspicious, especially if they're at a young age, that there might be a genetic syndrome going on.
Now, and if you have a family member that has had colon cancer, when should you start your screenings?
So it really depends on the age that they were diagnosed. We recommend starting 10 years earlier than when they were diagnosed. However, if you have a genetic mutation associated with colon cancer, we sometimes start as young as 20 or 25 and repeat those colonoscopies every 1 to 2 years. So it's much more aggressive screening than in the general population who typically start at 45 to 50 and then repeat the colonoscopies every 10 years.
So, I mean, that's what you should do if you find out you have this genetic mutation?
Yes, you should definitely start your screenings earlier. And as also we were talking about, they're associated with other cancers. So sometimes for women, if they're at increased risk for uterine and ovarian cancer, once they're done having children, they'll recommend to remove both their uterus and their ovaries to reduce their risk.
You find a lot of people being more conscientious because of family members and coming in to see you?
Yeah, I mean, it can be hard to hear. It can be scary to hear that you're at high risk for cancer because of a genetic mutation. However, a lot of people, once they're done, are glad they know, and they say, you know, knowledge is power. Now that I have this information, I know what's finally causing the cancer in my family, and I can act on it, start my screenings earlier, and hopefully prevent colon cancer in them.
Giving you a chance to be proactive. All right, Emily
Exactly.
Kaczynski, thank you so much for coming in. All right, our experts are still going to be taking your calls till 6:30. Again, that number is 410-481-2222. Emily, thanks for coming in.
Thanks for having me.